Hello everybody and welcome to UroChannel. A couple of weeks ago I uploaded a video about the risks of erectile dysfunction in connection to an infection with COVID-19. Some of you wanted to know what to do about it. In this video I'm giving you my personal expert opinion and rationale for taking Viagra or Cialis on a regular basis against ED and long COVID. Viagra and Cialis belong to a group of drugs that is called PDE5 inhibitors. For the sake of you knowing what I'm talking about, I used brand names to start with. I'm not paid from any pharmaceutical company, and there are also others, Standra and Levitra. Now I've named pretty much all of them and may shift to calling them PDE5 inhibitors. PDE5 inhibitors may play an important role in treating COVID-19 related erectile dysfunction in the future. I am saying may play an important role, since for the time being there are no scientific publications on this topic. But I'm sure this will change in the months and years to come. So all I can do today is to give you an educated guess what to do when you experience ED after being infected with the virus. This is by no means a medical consultation, and you should check with your doctor first whether you are eligible for the drugs outlined in this video. My name is Stefan Buntrock. I'm a urologist and sexologist. So how do PDE5 inhibitors work? There are a lot of misconceptions about it, and I know from my daily work that many of you think that you take one of those tablets and immediately you will start to get an erection out of nowhere, and that it also acts like some sort of aphrodisiac. I'm afraid that's not correct. PDE5 or phosphodiesterase 5 is an enzyme that is involved in a wide-ranging signal transduction system in the body. It is the so-called nitric oxide cyclic guanosine monophosphate PDE5 pathway. In short, nitric oxide is necessary for smooth muscle relaxation. Thus, the erectile ability of the penis and PDE5 reverse this process. This means that a PDE5 inhibitor knocks out phosphodiesterase 5 for a while, and as a result, erections will be facilitated. Now here's the thing. Phosphodiesterase 5 is also abundantly expressed in the lungs. This is the reason why PDE5 inhibitors are successfully used for the treatment of pulmonary hypertension, because they cause blood vessels in the lungs to relax, which lowers blood pressure as blood flow through the lungs is increased. As you know, lung inflammation is the main problem in COVID-19. It is thought that the virus is making a mess of the equilibrium within the NO-cGMP PDE5 pathway, which will cause a massive inflammatory response. PDE5 inhibitors might help to counteract inflammation by balancing this pathway. A detailed outline of the factors involved would be far beyond the scope of this video. Fact is, PDE5 inhibitors display a number of anti-inflammatory, antioxidant, and immune response regulatory properties that may help to combat and reverse COVID-19 manifestations. This means in the whole body. Stop thinking penis. Start to think within a bigger context. I know that this is difficult stuff, but some basic information is needed to understand why I think that regular administration of PDE5 inhibitors might be a good idea. A recent study in 443 patients formerly mildly to moderately infected with COVID-19 showed long-lasting sequelae at a median follow-up of 9.6 months. Specifically, the researchers noted a mildly lower total lung volume, higher specific airway resistance, a slightly limited heart action, decreased kidney function, and more frequent deep vein thrombosis. They didn't look at erectile function, but as I've already reported in my former video, there is evidence showing long-term erectile issues. Due to the inflammation, the release of nitric oxide within the penis is compromised. PDE5 inhibitors have the properties to change that, as I've just outlined. Combining all of this information is making a case for the use of PDE5 inhibitors for the treatment of erectile dysfunction after the infection with COVID-19. Sifting through the literature, I found there were no differences noted between long-acting and short-acting PDE5 inhibitors. Just from personal taste, I'm more on the long-acting side because it is one daily dose, whereas short-acting substances will have to be administered a few times a day. The long-acting drugs are tadalafil and avanafil. In some countries in the world, also sildenafil. Sildenafil and vardenafil are short-acting. I will keep you updated on new developments as more research will appear with time. Please subscribe to my channel. Thanks for watching. Bye bye.